Go.
Yep. All right, so we're gonna talk about how to do retraining for the musculature and the mechanics of the hip and knee and pretty much the whole lower body here. So say you have a form of collapse, more commonly for people is the Varus collapse, which is the knee coming in like this. And oftentimes you'll have the toes out like this as well. So we're going to be in seated because oftentimes with this comes a lot of knee pain. So it's hard to bear weight or hard to correct this actively as you're bearing weight. So I'm using a weight here, but what you'll probably want to do is sit at a sturdy table, like a dining table or something, and put your foot up against one of the legs like this. And so I'm going to correct my toes. Say my toes are out like this, I'm going to correct them in like that to neutral up against that leg so they don't move. And I'm going to position my chair and my body so say I'm here, at least my foot is neutral like a ski. And what I'm going to do with my hands is I'm going to take, this is my right leg, so I'm going to take my right hand and I'm going to put it on the hip area. So we're in a flex position, and so we're turned in, so we want to basically turn the femur. We're focusing on the femur here out. So I'm going to take my left hand on the distal end of the femur on the inside of my thigh towards the knee, and I'm going to grip it here, or I can grip it here. I'm going to put my right hand for the right knee on the outside towards my hip joint, towards the crease here. And so I'm going to stay tall with my body. I'm going to rock, and I'm going to push down like I'm squashing a bug, specifically through my heel, but my whole foot stays flat. And I'm going to do this almost like I'm trying to stand up out of my seat. And I'm going to try to practice engaging those muscles to kind of basically guide the femur and keep the foot and the tibia and fibula neutral. So if I had the opposite issue where I'm more bow-legged, I'm going to have that table leg on the inside and keeping that foot straight there, and the knee's going to want to be here, so I'm just going to switch my hands. So basically I'm going to be kind of pulling in here, going out there, and you can adjust the hands one way or the other depending on how what feels best for you. So we're just kind of working through here like this, but making sure that knee and the toes, the knee and the hip all stay aligned here, but just making sure that we kind of get the right adjustment to channel the weight bearing through the leg like that. Okay.